Occupational therapists work on handwriting. Occupational therapy is like physical therapy, but not. I'm making this video today because more and more people are hearing about occupational therapy, but it doesn't seem like everybody knows exactly what it is. In this video, I'm going to break down exactly what it is and what it looks like in different places for kids. The more you understand what an occupational therapist does, the more you'll be able to get exactly what you need for your family. This video is just for education purposes. It's not to tell you that you do or don't need an occupational therapist. If you have any concerns about your family's needs, talk with your healthcare team. An occupational therapist helps you improve your ability to perform occupations. That tells you nothing, but when you find out what an occupation is, you'll find out what an occupational therapist is. An occupation is anything you need to do or would like to do. I think of it about anything that really occupies your time. So what does your kid need to do or want to do? This is not a trick question. They need to eat, sleep, play, learn how to take care of themselves, like going to the bathroom and getting dressed. So that's what I love about being an occupational therapist. We make a really big difference in people's lives because we help people do what is important to them. So let's start with occupational therapy in the NICU. That's the neonatal intensive care unit. What does a baby need to do? A baby needs to eat or drink. So an occupational therapist in the NICU will help your baby learn how to drink from the bottle or from the breast. Another thing that they can do in the NICU is if your baby has a condition that might make their hands tight. Yeah, we don't want that because they won't be able to use their hands if they're in a tight position. So an occupational therapist could put splints on your baby's hands. You can think of that as like a brace or something to keep their muscles long to be able to do things that they need to do or want to do as they grow up. So you definitely want occupational therapy in the NICU if your baby is having trouble drinking or showing problems with their hands. I would say there's no con of getting occupational therapy in the NICU. Another place that your kid can get occupational therapy is in a hospital. If they had like a brain injury, something happened to them, or if they had a stroke, they might be having trouble with the things that they need to do or want to do. So that's what it looks like in the hospital. They're pretty intense situations that you might need an occupational therapist in the hospital. Again, I don't think there's a con of working with an occupational therapist in the hospital. Get your baby or get your kid what they need, the help that they need in the hospital to be able to thrive in their daily lives. So another place that your kid can get occupational therapy is as part of an early intervention program. Early intervention programs are run by each state a little differently. So I'm just speaking about my experience in Texas. Kids that get early intervention occupational therapy are at risk for developing delays or already showing delays. Kids who might need early intervention occupational therapy are kids with Down syndrome or other genetic things, kids with autism, if you catch it early enough, premature babies or multiples, they might be at risk for delays. So the whole point is to find the delays early, catch them, or even prevent them from happening. The big focus in early intervention is parent coaching because little kids, they're not going to school yet. They're with their parents or caregivers pretty much all day. So when the parents know what to do, they make the biggest improvements. Because of the parent coaching part, sometimes occupational therapists only see you for early intervention once a month to kind of like check in and see if things are going good. But they can also recommend like every other week or one time a week, whatever they think. But it's more common in early intervention to see them less often. A pro of early intervention is that you're catching things early. So if you have any sort of doubt, get your child evaluated. And that is another pro, that all the evaluations are free, at least to my understanding. So get the evaluations, see how your kid compares to other kids, and make decisions from there. If you have any doubt, it's not going to harm you in checking it out and seeing what they recommend. A con of early intervention is that it ends in most states when the kid turns 3. It doesn't go all the way to through the 3rd year. So if you're kind of catching something when they're 2.5, you only have like 6 months to make a difference. So it's very important that you act quick. Another thing with early intervention is that a lot of times they're just underfunded. So that could mean a wait list until you're evaluated, and then by the time you actually see a therapist, it could be even more time. So those are like the big cons, that there might be a long wait list and you only have a very small window to actually receive the therapy. After early intervention comes the schools. Usually early intervention will, when you kind of graduate from early intervention, you can get an evaluation by the schools. The thing with the schools is that occupational therapy that you get in school has to relate to going to school. So you can work on, your kid can work on things like paying attention in class, or being organized for class, being able to manage his clothes as he goes to the restroom, stuff with the cafeteria, just things like that. The pro is that your kid is going to be in school for a very long time, until his late teens or early 20s. So whatever he learns in school with the occupational therapist will carry on with him for several years. The con of school OT is that it is limited. It has to relate to that. It kind of doesn't take into account what goes on at home. And another con is that sometimes those therapists see a lot of kids. So maybe your kid might only get 30 minutes once a month or something like that. So if you're wanting more intense therapy, a school OT might not be the way to go. Okay, so another option to get occupational therapy is in a clinic. A clinic is usually just like a private business. You have more freedom in the clinic to work on exactly what you want to, depending on insurance approval and stuff like that. But the clinic gives you more opportunity to work on your daily life stuff. Your kid can start in a clinic as early as when he's a baby and all the way up to being 18. From what I've seen, most kids are in the clinic are between like 2 and 8. But definitely younger, and there's definitely older. A pro of getting occupational therapy in the clinic is that they usually have so much equipment and just supplies and space and fun stuff and toys, so you can find out what works for your kid in the clinic and then try to carry it out at home. So that brings me to a little bit of a con in the clinic, is that a lot of times you literally only have like 3 minutes to talk in the lobby or something like that. So there could be a disconnect between what your kid is able to do in the clinic and what they're able to do at home. And at the end of the day, the home part is the most important, right? So you need to stick up for yourself in the clinic and make sure that what your therapist is doing can translate into your home. Some clinics offer like intensive occupational therapy, and that can be like 5 days a week, 3 to 4 hours a day for like a month or maybe 6 weeks or something. That is another option if you live somewhere far away from a clinic, and if you're able to take off some time from work, you can pretty much make that you and your child's job to get that intense therapy all jam-packed into one short period of time. Another option for occupational therapy is home health. So that's when they come to you. Early intervention is a form of home health because they are driving to you for early intervention. For home health, obviously a big pro is that you have your stuff. So whatever your kid uses to learn during the occupational therapy session, they have at their home the whole time. So that's really high carryover. A con for home health is I can't think of a lot of cons for occupational therapy, home health, other than for some insurances, you have to prove that you are able to leave your home to get therapy because it's just a higher cost for whoever's providing it because they're driving around from home to home. So that's my understanding, that sometimes you have to prove that you need it at home to be able to have it covered by insurance. A good occupational therapist in any setting that you go to is going to listen to your concerns and is going to explain things in a way that you understand. If your kid does things with the occupational therapist that they don't do for you, that's a problem. They need to be able to do things for you. A good occupational therapist also looks at kind of like the big picture and also your family's strengths and your kids' strengths. We don't just want to keep focusing on the difficulties or the things that are hard. We want to look at how the strengths can help make up for some of the challenges. And a reason why you wouldn't need occupational therapy is just because your kid has something like Down syndrome or autism. Those are things that are part of their being. Like they have autism or they have Down syndrome. That doesn't mean they need therapy. That doesn't mean they're going to be in therapy for the rest of their lives. For occupational therapy, focus on something that your kid is having trouble with in his daily life and how you can make it better. So this was a super quick rundown. I'm hoping to not bore y'all, but if you have any other questions, drop it down in the comments below and I will be happy to answer. If you've taken away anything from this, it's keep the occupation in occupational therapy. Focus on the daily life, what they need to do, what they're having trouble with, and go from there. Don't just pinpoint a tiny little, he holds his pencil like this and then we're going to work on it for 6 months or something. Keep the occupation in occupational therapy. Hopefully you have a better understanding of what we do and where we do it, and you can see what would fit with your family's needs. Please like this video if you found it helpful. I want to keep making videos that are directed to parents. No BS, no like super fancy terms. I just feel like if we keep the knowledge to ourselves, there's no point. The whole point of me being an occupational therapist is to help families. If you are looking for an occupational therapist, I am a virtual occupational therapist in California and Texas. So if you live in one of those states, head over to my website, which is brightandearlyot.com, and request a free consultation. And you'll get me on the phone. We'll talk, see what you're looking for, see if I can help. And if I don't help, I'll point you in the right direction. Thanks for watching.